Hi, my name is Alauna Marie Harris in Bio 54, Section 80, and today I'm going to be talking about heart disease and a very specific heart condition called atherosclerosis. What is heart disease and atherosclerosis? It is very important that we all understand what heart disease and atherosclerosis is before we dive into the topic of talking about it. Heart disease, also known as cardiovascular disease, ranges from multiple cardiovascular issues by the names of coronary artery disease, high blood pressure, cardiac arrest, congestive heart failure, stroke, congenital heart disease, and atherosclerosis. Some of these diseases may develop before birth. Congenital heart disease affects premature babies and newborns. Other diseases such as coronary artery disease, high blood pressure, and congestive heart failure may change over time with getting older and lifestyle changes. Atherosclerosis is a very specific cardiovascular disease in when your arteries, which carry oxygen nutrients from your heart to the rest of your body, become thick and stiff, restricting blood flow to organs and tissues. There are roughly around 3 million cases per year in the United States about atherosclerosis, which makes it a very common disease. Although it is common, this is only one type of cardiovascular disease between many others that could affect many people each day, monthly, and yearly. Atherosclerosis symptoms. People who suffer from atherosclerosis may not experience any symptoms until a plaque ruptures or the buildup of plaque is severe enough to stop blood flow. Although there are no symptoms, people may experience heart attacks, also known as cardiac arrest, mini strokes, poor wound healing, and can even lead to bigger strokes and death sometimes. Mild atherosclerosis may not have any symptoms, but is just as serious. Something as little as chest pain can indicate cardiovascular disease. Treatment. It is highly advised that if you fear you suffer from any cardiovascular disease, to please see a doctor or physician for medication and newer developments that may help you or someone in the future. High blood pressure, high cholesterol, insulin resistance, high triglycerides, and inflammation from other diseases such as lupus and other infections can lead to atherosclerosis, congenital heart disease, and other types of heart failure that may affect you in the future. Other than medical treatments by medicine, a patient suffering from cardiovascular disease can help themselves by eating healthier, managing stress, stop smoking, and exercising more. And if nothing helps, then surgical and medical attention is required. Diagnosis. A doctor's diagnosis of atherosclerosis not only depends on a weak or absent pulse below the narrow of your artery, decreased blood pressure in an affected limb, and whooshing sounds also known as bruits over your arteries that can be heard using stethoscopes. Physicians and doctors also depend on a physical exam, and they will highly recommend that you do another diagnostic test. These can be of the following. Blood tests. Lab tests can detect increased levels of cholesterol and blood sugar that may increase the risk of atherosclerosis. Doppler ultrasound. Your doctor may use a special ultrasound device to measure your blood pressure at various points along your arm and leg. These measurements can help your doctor gauge the degree of any blockages, as well as the speed of blood flow in your arteries. Ankle brachial index. This test can tell if you have any atherosclerosis in your arteries, in your legs, and feet. Electrocardiogram, also known as ECG, an electrocardiogram records electrical signals as they travel through your heart. A stress test, also known as an exercise test, is used to gather information about how well your heart works during physical activity. Exercise makes your heart pump harder and faster than it does during most daily activities. An exercise test can reveal problems within your heart that may not be noticeable otherwise. Cardiac catheterization angiogram. This test can show if your coronary arteries are narrowed or blocked. Medication. Medication for atherosclerosis is highly needed because high blood pressure, high cholesterol, and insulin resistance can be seen and there may be blockages in your arteries. However, for some other cardiovascular diseases, lifestyle changes may be enough to reverse their disease. Some medications specifically for atherosclerosis are for the following. Cholesterol medications aggressively lowering your low-density lipoprotein LDL cholesterol, the bad cholesterol, can slow, stop, or even reverse the buildup of fatty deposits in your artery. Antiplatelet medications. Your doctor may prescribe antiplatelet medications such as aspirin to reduce likelihood that platelets will clump in narrowed arteries. Beta blocker medication. These medications are commonly used for coronary artery disease. They lower your heart rate and blood pressure, reducing the demand on your heart and often relieve symptoms of chest pain. Beta blockers reduce the risk of heart attacks and some rhythm problems. Angiotensin converting enzyme inhibitors, also known as ACE, these medications may help slow the progression of atherosclerosis by lowering blood pressure and producing other beneficial effects on the heart arteries. ACE inhibitors can also reduce the risk of recurrent heart issues. Water pills. High blood pressure is a major risk factor for atherosclerosis. These water pills help lower blood pressure. New developments and major surgery. Cardiovascular disease is a very serious issue and affects millions per year. Doctors have strived in clinical trials and personal studies to help the general public understand their bodies. An insufficient amount of sleep can lead to being at higher risk of cardiovascular disease, heart disease, and cancer risk symptoms can be linked. Cancer patients are at a higher risk of dying from heart disease and stroke, and many more studies. These are titles of researchers and peer-reviewed that are just in the month of November 2019. When you look up atherosclerosis and peer-reviewed in your search bar, you can find that there are thousands of more researchers and doctors and physicians helping to some clinical trials by Mayo Clinic on new developments for atherosclerosis is using ultrasonography, shear wave elastography, strain imaging, and 3D volume ultrasonography on cardiovascular disease. Angioplasty and stent replacement, endarterectomy, fibrinogen therapy, and bypass surgery are all types of major surgeries that can help clear atherosclerosis and other cardiovascular diseases. Only these surgical procedures are needed if symptoms are extremely severe and blockage that threatens muscle or tissue survival. In conclusion, if you or anyone fears that they suffer from atherosclerosis or any major heart disease, please see a doctor immediately. Cardiovascular disease is the number one leading cause of death for both men and women in the U.S. About 610,000 people per year in the United States die from heart disease. At least 48% of adults in the United States suffer from cardiovascular disease, whether it be high blood pressure or something as serious as stroke. Although these numbers are alarming, we can see breakthroughs with technology and research that can be helpful to our own benefit and apply to our daily lives. New developments of medicine can even slow down or reverse your heart disease unless it is severe, like going into cardiac arrest, also known as heart attack. Being at high blood pressure is a major indicator of onset heart disease and can easily develop into more if not taken care of immediately. Overall heart disease being the number one cause of death in America indicates that we have an issue with our health and that we all need to take better care of our bodies. Doctors and researchers work hard to develop breakthroughs to help those in need. We as a general population also need to help ourselves by maintaining good health and being as stressless as possible. Thank you. My name is Alauna Marie, and this is my presentation on heart disease and atherosclerosis.